Welcome to the deep dive. We're jumping right in today with a new development concerning COVID-19. There's a new variant, NB.1.8.1,
That's right. It's been linked to, well, quite a surge in cases and hospitalizations too over in China and some parts of Asia.
and now it's here in the US. We're seeing reports based on CDC data collected via Ginkgo Bioworks, that airport testing partner first flagged by CBS News.
Exactly. So our mission today really is to unpack this. What is this variant? What's the actual impact look like based on the data we have so far?
Right. We want to give you, our listeners, a clear picture without, getting lost in the weeds, just the essential info.
Your shortcut to staying informed, basically.
Okay, let's start with the U.S. detection then. Where exactly has this NB.1.8.1 popped up?
So the reports mention it being found in international travelers, specifically people arriving in California, Washington State, Virginia, and also New York City.
And were these travelers all coming from China, given the surge there?
Not just China, actually. It was quite a mix. Between late April, around the 22nd, and May 12th, travelers came from 9 countries.
Oh, nine.
Yeah, China, Japan, Vietnam, South Korea, Taiwan, Thailand, but also France, the Netherlands, and Spain.
Interesting. So Europe too. And you mentioned this wasn't technically the first time it was seen in the U.S.
That's also true. It had been picked up a bit earlier, back in late March. There were detections in Ohio, Rhode Island, and Hawaii then.
So it's been around maybe at very low levels for a little while before these more recent traveler detections. Okay, let's shift focus to Asia then. What's happening in China that's causing concern?
Well, the data coming out of China is pretty striking. They're seeing a definite uptick in hospitalizations linked to this variant.
How much of an uptick are we talking?
Okay, so look at severely ill respiratory patients. The proportion of those who also have COVID, it's almost doubled in the past month. Went from 3.3% up to 6.3%.
Wow, okay, that's a significant jump in severe cases.
It is. And it's not just severe cases. If you look at emergency room visits, the proportion of ER patients testing positive for COVID has also shot up. More than doubled, actually from 7.5% to 16.2%.
That sounds like it's putting real pressure on their health system.
It certainly suggests a growing burden, yeah.
And what about other places in Asia? You mentioned Taiwan earlier.
Right, Taiwan reported a huge jump, 78% increase in COVID emergency room admissions in just 1 week. Now, that data was up to May 3rd, but still.
So only 8% in a week is massive.
It really is. And then there's Hong Kong. Hospitalizations there hit a 12-month high.
A 12-month high.
Yeah, and officials there believe NB.1.8.1 is the main driver. It's actually led them to start recommending masks again in certain settings.
And in Taiwan, it's become the main strain circulating.
Yes, exactly. The data shows it's dominant there now. In the latest week, we have numbers there were over 19,000 visits for COVID.
Okay, so a very different picture in parts of Asia compared to what we seem to be seeing here so far. Let's dive into the variant itself. What makes NB 1.8.1 tick? Why might it be causing these surges?
Well, the early research, mostly out of China, suggests it might just be more infectious.
More infectious? How?
The thinking is it could be better at binding to our cells. Imagine it has a slightly better key for unlocking the cell door. If it gets in easier, it can spread faster. We've seen that kind of thing before with other variants.
Right, that improved binding often leads to higher transmissibility. Okay, that makes sense. But what about immune evasion? That's always the other big question. Can it get around our existing immunity from shots or past infections?
Yeah, that's crucial. And interestingly, the research we have so far suggests no. It doesn't seem to be any better at dodging our immune systems than the other variants already floating around.
Oh, that's actually quite significant. So potentially spreads easier, but doesn't necessarily escape immunity any better.
That seems to be the picture for now, yes. Which might help explain the U.S. situation.
Okay, let's talk about that. Despite finding it in travelers, what is the current COVID situation here in the U.S.?
It's quite different. There's really no sign right now of widespread transmission of MB.1.8.1 within the U.S.
No sign.
No. In fact, if you look at the overall COVID test positivity rate nationally, it's actually gone down. Fell by about 12% in the latest week we have data for.
Okay, that's definitely good news. So variant detected, yes, but not really gaining traction, it seems.
Not yet, anyway.
Which brings us to vaccines. I know the FDA had a meeting recently talking about updating COVID shots. Was this variant part of that discussion?
It was mentioned, yes. The FDA advisors met to discuss, what the next generation of COVID vaccines should target.
And what are the current ones targeting?
Right now, they're primarily designed around the JN.1 variant and its offshoots, its descendants. For context, JN.1 was dominant for a while, and now one of its descendants, LPE.8.1, is the main strain circulating in the U.S.
So LP.8.1 is dominant here, while NB1.8.1 is causing trouble elsewhere. Did the FDA or CDC give any indication they need to switch targets because of NB.1.8.1?
Well, at that meeting, officials pointed out that within the U.S., the only strain showing really significant growth lately is actually something called XFC.
XFC. Okay, another one.
Yeah. So while they're absolutely watching NB.1.8.1, it's not showing that same growth pattern here. The focus seems to be more on the JN.1 family, including strains like XFC that are increasing domestically.
So no immediate plans for an NB.1.8.1 specific vaccine based on the U.S. situation, but they're monitoring. How exactly are we keeping tabs on these variants coming in?
So that airport surveillance program is key. The CDC works with Ginkgo Bioworks. They have voluntary testing set up at certain international airports.
How does that work?
Travelers can choose to do a quick nasal swab themselves, fill out a short survey, and then those samples get tested for various things, including COVID variants. That's how we're getting this data on NB.1.8.1 in arrivals.
Right, so it's a proactive way to get an early warning signal.
Exactly. It helps track what's entering the country.
And just to circle back quickly, you mentioned Hong Kong recommending masks again. What exactly are they advising?
Yeah, officials there are urging people at higher risk to wear masks in public places. And they're also recommending masks more broadly on public transport and just in crowded indoor areas, given that spike in hospitalizations they're seeing.
Okay, so let's try to bring this all together then. We have this new variant, NB.1.8.1. It seems to be causing significant issues, like hospital surges in China and other parts of Asia. It has been found here in the U.S., mainly in travelers from various countries, and was even detected sporadically earlier.
Right.
Early research suggests it might spread more easily, that cell binding idea, but importantly, it doesn't seem better at evading immunity.
Correct. That's a key point.
And despite being here, it's not driving widespread transmission or an increase in cases overall in the U.S. currently. Our dominant strains are different.
Yes, the U.S. picture is quite stable, even improving slightly by some metrics right now.
Monitoring is happening, especially at airports. And vaccine discussions are ongoing, but the immediate focus isn't necessarily on this specific variant for U.S. shots. Meanwhile, places like Hong Kong are taking precautions like recommending masks again.
That sums it up nicely. It really highlights how variable the impact of these strains can be geographically and why ongoing surveillance is so critical.
It definitely makes you think, doesn't it? As you listen to this, consider what it means for global health when these new variants can pop up and travel so fast across borders. The impact might be really different in, say, Hong Kong versus Ohio, but it's still part of the same global picture. What role does that constant vigilance, that international teamwork really play in managing these situations effectively? Something to chew on. Thanks for taking this deep dive with us.